Here's to your health, brought to you by Coliseum Health System. We've all said, "Oh, my aching back," but today we'll introduce you to a new technology that's providing faster, safer, and longer-lasting ways to ease those aches. It's the O-Arm imaging system. Here to tell us more is neurosurgeon Dr. George Stefanis.
The O-Arm is a three-dimensional CAT scanner, basically, and this machine is like a CAT scan. If you were to ever have a CAT scan for any part of your body, it's a big round circle, and this is the same type of thing. It is used in the operating room where we can move it in and out around patients. Once we get the information from the 3D CAT scan, then we use a stealth navigation system, which is a computer, and what that does is it allows us to map out the spine, and it gives us like X-ray vision to see things that a CAT scan. In other words, we can actually touch a part of the spine and we can look on the screen and it tells us exactly where we are and what direction we're going to.
So how does this technology compare with traditional spine surgery? Here's neurosurgeon Dr. Kevin Stevenson.
With traditional spine surgery, you're relying on external visual cues as to where to make a cut in bone, where to place instrumentation, where to take pressure off of nerves. With the O-Arm, this technology not only shows you external visual anatomy, but also allows you to almost have X-ray vision through bone, through spinal cords, into the patient without actually seeing it. So it's sort of an extra set of X-ray goggles, if you will. Additionally, it allows you to do surgery without ever even seeing the spine, such as minimally invasive spine surgery or minimally invasive fusions, where I actually never see the patient's spine at all. The surgery is done through a series of 2-centimeter stabs rather than a big incision. And that's a big improvement in spine surgery.
Who qualifies as a candidate for this surgery?
We like to use it on people who have unusual anatomy. Let's say someone who's had previous surgery where all of your traditional landmarks are not there. Another doctor has done surgery and there are no landmarks that we use to guide us to do our surgery. The O-Arm helps guide us and tells exactly where we need to be and what we need to do as far as stabilizing the spine. It can be used in people who have scoliosis, where they have a curvature of their spine, which helps us in finding the appropriate landmarks. So I think anybody who is doing complex spine surgery is a candidate for this, and this includes the neck, the thoracic spine, as well as the lumbar spine.
Dr. Stevenson comments on the advantages of this procedure at the close of a successful surgery.
Again, there's just so much less pain to the patient, so much less blood loss, and so much less destruction of normal tissues that all that adds up to better outcomes for patients and just a return back to their normal life, work, play, and everything in between in weeks rather than months. So it's more than just a fancy way of doing something. There's a real benefit to the patient. So like I said, this guy will be home in his own bed tonight rather than 3 days in the hospital. And he can be back to work or his activities, with the exception of, say, contact sports, within a couple weeks. I think it's a big game changer in spine surgery on really every level. It makes spine surgery safer, more accurate, better for the patient, and also allows us to do procedures that we could not do prior to this technology, or makes those procedures much safer and easier for patients. It really opens a whole new world to both patients and physicians.
Thank you for watching Here's to Your Health, brought to you by Coliseum Health System.